All right, you guys. I'm so excited to have our next speaker join us for our final session of Eye on Mental Health today. That speaker is going to be psychologist Allie Dashow, and she is also an ocular melanoma patient. If you guys joined into the Eye on Mental Health last year, Allie was one of our presenters last year, and she talked a little about radical acceptance and just some of the different modalities of mental health support. And so today she's going to be diving in a little more specifically to a few things you could really hone in on adding to your mental health toolbox. And she has a really excellent presentation. I hate to amp her up, but you guys, we've had some really great speakers today. So Allie, I'm going to go ahead and welcome you on stage so that we can get started.
Thank you all so much for having me here. Very excited to be here today. Of course, with any cancer, there is a lot of anxiety and mental health struggles that come along with that. But I think especially when you think about having a rare cancer, there's so many extra barriers and stressors and uncertainty that comes along with that. And I'm so glad that we have this space to talk about mental health, as I'm sure everyone with this cancer diagnosis, and of course, any cancer diagnosis, whether you're a patient, caregiver, loved one, you're impacted in a way. I know for myself, I've definitely dealt with anxiety around my diagnosis and the unknowns. And I feel so lucky that I have the tools in my pocket to know how to deal with that. And I'm so happy to be here today to hopefully share some of those things with you. So I'll start by just going through the agenda. So I'll mainly be talking about a type of therapy called cognitive behavioral therapy. And then we'll go into acceptance and commitment therapy. I mainly practice from a CBT, cognitive behavioral lens. So again, that'll be the focus. And ACT might be a therapy that some of you may have heard, may not have heard, but it's definitely a newer type of therapy that has become more popular, I would say, within the last decade. And then we'll end by just talking about some challenges and suggestions to think about when searching for a therapist. So we're going to start with CBT. So CBT is a type of therapy that is very focused on the present. It's focused on what's happening right now and is centered around meeting your goals, helping you get your life to a place where you want it to get to. It's definitely a more structured kind of therapy. And here we use cognitive and behavioral strategies to help patients change. So the basis for CBT, cognitive behavioral therapy, is something called the cognitive triangle, which is what we see here. And the cognitive triangle basically tells us that our thoughts, our emotions, our behaviors are all interconnected. So if we change one point of the triangle, so if we try to target someone's emotions, that should theoretically help change someone's thoughts and behaviors as well. So they all impact one another. So I'll just offer just like a brief overview of this. So let's say you just had your scan, you're feeling anxious, you're feeling sad, you're really just not in the mood to see your friends, right? So emotion is sadness. And the thought is, if I go to see my friends, I'm not going to even enjoy myself. So that might affect your behavior. You then stay home, you isolate, and that might then just exacerbate whatever sadness you're already experiencing. But if we can, let's say, target the thought by creating a more realistic thought. So the initial thought is, I'm not going to enjoy myself if I see my friends. And then you try and challenge that thought a little bit. And you say, you know what? I'm most likely going to have a good time. Like I usually leave seeing my friends being in a better mood than I was when I first got there. So by changing your thought, you may then decide to actually change your behavior, right? You go to see your friends and it might actually change your emotion and might actually help you feel less anxious and more connected to the ones around you. Right. So we change one point in the triangle and it can change the other two. And we'll talk more in a couple minutes around what that can practically look like. Like, how do we actually do that? So just a little bit more information on cognitive behavioral therapy. So with CBT, as I said, we can target things from a cognitive lens. So first, we want to help increase one's awareness of their inaccurate thoughts, right? So as human beings, we're always going to have thoughts that aren't entirely true. So I might have the thought that in 5 minutes, I'm going to find out that I won the lottery. That would be great. But we, I think, could all agree that most likely that will not happen. That will definitely not happen because I did not even buy a lotto ticket, right? So we want to help people just notice these thoughts that might not be fully accurate. Then from a cognitive lens, we also want to help patients, or all of you and people in general, notice patterns of thinking that might be maladaptive. So as human beings, sometimes we catastrophize or we overgeneralize. So we just want to increase that awareness, notice those patterns, notice those traps we tend to fall into. And then from there, in CBT, we help our clients reframe these unhelpful thoughts by generating more adaptive or helpful thoughts. And when I say reframe, we're not talking about falling into toxic positivity or anything like that, or invalidating your thoughts or minimizing them. You'll see in a minute when we go through what's known as a thought record, what this looks like. But essentially, we want to take all the evidence that we have, and based on the evidence and the facts of the situation, then we want to see, okay, is my thought maybe inaccurate, and how can I make it more balanced? Then from a behavioral lens, something else we do in CBT is we help our clients engage in more goal-dependent behavior instead of mood-dependent behavior. It's actually reverse on this slide, so I apologize. So mood-dependent behavior is when we act based on our mood, right? I'm in the mood to go to sleep, I'm going to go to sleep. I'm not in the mood to do my dishes, so I'm not going to do my dishes. Goal-dependent behavior is when we act based on our goal, regardless of our motivation, regardless of our mood, regardless of how we're feeling. And now it's normal to engage in mood-dependent behavior. We do that all the time. Last night, I was exhausted and I meant to brush my teeth, but I was like, you know what, F it, I don't want to. I'm too tired and I went to sleep, right? Mood-dependent behavior. So there's nothing wrong with that. We don't need to judge ourselves. But we know that when we tend to engage in a lot of mood-dependent behavior, that's when a lot of depression and anxiety can come in. And so with our clients in CBT, we help them engage in pleasurable activities, so activities that bring you joy, a sense of connection, and also mastery-related activities, so things that make you feel competent and accomplished and productive. So in addition to that, from a behavioral lens in CBT, we might also help you decrease avoidant behaviors. So we tend to engage in avoidant behaviors at times because in the short term, it feels good. But in the long term, it might actually cause us a lot more issues. So you can take someone who is maybe anxious about going to the doctor, so they don't go to the doctor, right? They don't go, they don't want to know what's going on with their health. In the short term, feels good. They don't have to deal with anxiety. They don't go, so anxiety goes away. But in the long term, right, that can contribute to more issues. And so we might help our patients gradually expose themselves to the thing that they're avoiding, let's say going to a doctor or watching a TV show that has like a medical component to it. So I have this slide here just to briefly give you all some terminology as to the type of interventions we use with clients in CBT. So if you're dealing with depression, we tend to do behavioral activation, which we'll talk more about in a few minutes. If you're dealing with anxiety, we tend to use exposure therapy, which is what I was just referencing. We gradually help someone in a systematic way sort of be reintroduced to the things that they've been avoiding. Then we have cognitive restructuring, which we use for depression and anxiety. We're going to talk about that in a couple minutes. And one thing we're not going to talk about today, but I'll mention, is something called cognitive processing therapy. This is a therapy that's used when someone's dealing with PTSD, which can happen from a variety of traumas, but can also happen from medical trauma as well. So we're going to first talk about something called cognitive restructuring. How do we challenge and restructure our thoughts? And before we even do that, we need to first talk about cognitive distortions. So a cognitive distortion is a distorted thought pattern that is often exaggerated, and it skews our perception of reality, and it makes us feel more unpleasant emotions. So you can imagine if you're having more intense, exaggerated thoughts, your emotions are going to be much more intense. So a cognitive distortion can also be viewed as a shortcut. Now, in a minute or two, I'll show sort of a list of cognitive distortions. But one example is jumping to conclusions, right? Sometimes we jump to conclusions. Now, cognitive distortions aren't always a problem. They can actually be helpful at times. So for example, if I'm walking down a dark alleyway, there are no lights, it's 2 a.m., and I start to have anxiety, and my thoughts tell me that something bad's going to happen if I stay here, I'm jumping to a conclusion, right? I'm assuming something bad's going to happen, but that mental shortcut's actually helpful in that moment. It probably prompts me to leave that street, go somewhere that seems safer. So these shortcuts can help us. They can help us survive, can help us protect ourselves. So we don't want to judge ourselves for having distortions. We'll always have them, but we know that when we tend to have a lot of them, that's where that anxiety and depression can creep in. So I put some examples on this page of what these look like. We can start with the top left, the black and white thinking or all or nothing thinking. So you'll see on the image in the middle, there are already some examples there, but I also tried to include some examples on the left and right that might be more relevant to cancer. So a black and white thought might be like, my partner always says the wrong thing, right? Whenever I'm anxious, they always say the wrong. The word always is very black and white and is probably not fully accurate. Then we have mental filter, when we pay attention to only certain types of evidence that confirms our already pre-existing beliefs, right? So if I have a belief that I only ever get bad news, my brain is only going to notice the times where I get that bad news. And it's going to tell me, right, I only ever get bad news from doctors. Then we have jumping to conclusions, and there's two types. We have mind reading, where we imagine we know what someone else is thinking, and fortune telling, which is when we predict the future. So an example of fortune telling, my cancer is going to spread, or I'll never feel happy again. Then we have overgeneralizing. So we see a pattern based upon a single event, right? And we draw conclusions from that. So nothing ever goes right in my life, right? So maybe you have a few bad, awful things that happen, right? And we overgeneralize and say nothing ever goes right. Then we have disqualifying the positive. This is when we discount the good things that have happened in our life and we ignore them and only notice the negative. Always mess up, right? I'm always doing something wrong. Then we also have catastrophizing and minimizing. So minimizing, we're inappropriately shrinking something to make it seem less important than it is, right? So someone asks you how you're doing, or maybe you're doing terribly with some news you just got or with your scans, but you say, I'm doing fine, right? Or you say, oh, it's not a big deal that I have this diagnosis. And just a couple others I wanted to touch on as well. The first one is emotional reasoning. This is one of my favorites. So this is when we assume that because we feel a certain way, what we think must be true. So I want to flesh that out a little bit. So we all know, right? Like emotions are valid. We're allowed to have whatever feelings we have. But just because we have a feeling, it doesn't mean the emotion is reliable, right? Our feelings are not facts. So just because we have an emotion, it doesn't always depict an accurate picture of the world around us. So just because I feel anxious, that doesn't mean that I'm going to get bad results on a scan. But if I say, oh, I'm anxious, right, I know I'm going to get bad results on a scan, right, I might be using that anxiety to then suggest that these results are going to be bad. Another example of emotional reasoning is I feel angry at someone, so that must mean that they're in the wrong. Just because you feel anger doesn't actually mean they necessarily did anything wrong, right? Maybe you're just having a tough day and maybe you're taking your anger out on them. Another example is I feel embarrassed, right? So that must mean people are judging me. So with emotional reasoning, we're making conclusions based off of whatever emotion we're feeling. I feel so overwhelmed, so I know I'll never feel better. Then we have labeling. We assign a label to ourselves or someone else, right? I'm so ugly, or I'm so lazy, or they're so stupid. Then we also have should statements, right? Where we use these critical words like should or must, which then makes us feel guilty or can make us feel a lot of anger or frustration toward other people. So the problem with should statements is that it creates and places these unfair expectations on ourselves or someone else. Who gets to make the rules, right? We can have preferences or desires, but our preferences, our beliefs might not be the same as someone else's. And should statements are very black and white, right? I should have done this. He shouldn't have said this. So a thought of I should be over my diagnosis by now, right? Or I shouldn't be so upset, right? Who's to say that there is a timeline, right? Who gets to decide these things? Or I'm from New York, so sometimes when I'm in the city or even on Long Island where I live, when people are walking slowly, I'll have the thought of like people should just walk faster, right? And it's like, okay, but like, who am I to decide that like there is a certain pace that everybody should walk at? So one thing, just as sort of a side note, instead of using should statements, we can use something called preferential thinking. So instead of this very rigid belief of like, they should walk faster, right? I can say, I wish they would walk faster. I would prefer they walked faster, right? I wish this thing didn't happen, right? These should statements can make us feel very frustrated and irritable. And then the last one's personalization. So when you blame yourself for something that maybe wasn't fully your fault, or blame others for something that maybe was your fault. So prime example, right? I caused my cancer. This is my fault. So we have these cognitive distortions, right? And so now we want to talk about like, what do we do with them? So I'm about to show a slide that is visually not the most appealing, but we'll gradually go through it together. And the thing I'm about to introduce is called a thought record. So this is what we use with clients when we're trying to help them change the way they're thinking when they're having these distorted thoughts. A thought record looks super overwhelming, but the more you do it, the easier it gets. And it can be really helpful when we're having anxious thoughts or depressive thoughts or just unhelpful thoughts about other people or our situation. The top row just tells us what we're supposed to do in each column. So let's start all the way on the left. So first we want to write the situation that maybe contributed to an unhelpful thought. So the situation I have here, let's say you have an appointment with your oncologist and you discuss the importance of frequent scans because you had metastasis, let's say to your lungs at some point. And so you discussed frequent scans because there's of course a chance that the cancer could come back and spread. Right? And so the emotions you have 100% hopeless, 90% depressed, 88% anger, 95% anxiety. So one of the points here I want to make, if we could just, we'll even stop looking at this thought record for a second, is that situations can cause emotions. But oftentimes it's our thoughts and our interpretations about the situation that then exacerbates the emotion. Right? So the unhelpful thoughts here in the third column are, I'll never feel happy again. Nothing good ever happens. I only ever get bad news. And I'm feeling anxious and I just know my cancer will spread. So having the oncology appointment itself didn't necessarily cause these emotions to be this high, right? It might be some of these thoughts that are amplifying the intensity of these emotions. So after we write down the unhelpful thoughts we're having, we want to start by saying, okay, what evidence do I have to suggest that maybe these thoughts in part might be true, right? Because I'm probably having these thoughts for a reason. So some evidence, I felt pretty sad and overwhelmed since my appointment. So when I have this thought, I'll never feel happy again, right? Okay, well, I have been feeling pretty sad since yesterday. And then next piece of evidence, this is all so unsettling and I'm always going to have to worry about metastasis, right? And my cancer spreading. Fair thought, that makes sense, right? Those are facts. This is unsettling and there is always a chance it could spread, right? And maybe some other evidence, I was diagnosed with cancer 5 years ago and had mets 2 years ago. I've gotten bad medical news. So it's fair, it makes sense that I would have this fear that I only ever get bad news, right? Or I know my cancer will spread. Doesn't mean those thoughts are true, but these pieces of evidence contribute to that, having that thought in the first place. So we say, okay, this is the evidence that suggests this thought might be true. What evidence do we have to suggest that this thought might not be entirely true? And we want to start by looking at the cognitive distortions that are in the thought. So when we're now looking at evidence that doesn't support the thought, we want to say, okay, what distortions might be in my initial thoughts? So I wrote some down here that fall into the thoughts in the third column. And now we want to think of other evidence. So what evidence suggests these thoughts aren't true? Well, ever since my diagnosis of cancer and mets, I've had moments of joy and happiness. So that initial thought of I'll never feel happy again probably isn't true because I have had moments of feeling good. Initial thought was I know my cancer will spread. Evidence against is I can't predict the future, right? I don't have a crystal ball. This belief that I'm never going to feel happy again, we can challenge that by saying, well, emotions aren't permanent. They don't last forever. This belief I only ever get bad news, we wrote down, I have gotten good news that my lung lesion is gone and I was NED, no evidence of disease on my last scan. And maybe I also just got the job I wanted and found out my salary will be increasing, right? Like not everything is bad news. And then the last, worrying my cancer will spread, won't make it spread, right? Our thoughts have no bearing on reality. So now we have evidence on both sides. And now what we want to do is integrate both sides to create a more balanced thoughts. And again, it's really important that we take the evidence that supports the initial thought into account. Because if we suppress it, if we ignore it, the new balanced thought is not going to feel believable. So I wrote down some potential balanced thoughts and I'll just read them through. And so these are all challenges to the initial thought. So I'm down and anxious right now, and it might take some time to get out of this funk. I've felt this way before in the past, and it's temporary. I'll have good and bad days. Cancer is a life-altering diagnosis. I'm allowed to be angry about it and feel like I got the short end of the stick. At the same time, I have had good things happen in my life recently. In fact, it's amazing that I'm currently NED, meaning no evidence of current disease or metastasis. Cancer takes up a huge part of my life, and that doesn't mean that nothing good will ever happen. I'm not a fortune teller, and worrying about the future won't change it, and it's understandable that I'm worried. And lastly, anyone in my shoes would be worried, and I need to remind myself that having a gut feeling my cancer will spread has no impact on reality. Just because I feel worried doesn't mean something bad will definitively happen. And so, zooming out for a second, the main point here is that if we can notice these distorted thoughts and challenge them, the intensity of our emotions might go down. So all the way on our right, we re-rate our emotions now that we've had these alternative thoughts that we're thinking. You can see here the intensity of the emotions went down. Sometimes the intensity of the emotions might not go down, and that's okay too. And a lot of the time, you probably will find that it'll decrease. So that's one tool. Now, here is a list. There's no need to even read this. There's a ton in this slide. Again, I'm happy to send it out. But basically, here are prompts that can help you identify evidence that does not support the initial thought, right? Because sometimes it can be hard, right? We believe that initial thought, it's hard to think of anything different. So there are some prompts here that can help us expand our thinking and think more flexibly when filling out the thought record. So now we're going to change gears a little bit. I want to talk more about like the behavioral interventions we use in CBT. So this image is all about the cycle of depression. So at the top, it talks about low motivation, right? So when you're depressed, you don't really have much motivation to do anything. And so you stop engaging in activities that you once did. Maybe you stop seeing friends, you stop engaging in hobbies, right? You avoid, you withdraw. And when we do that, you probably have an increased sense of worthlessness and hopelessness about your life. And so what happens is there's also some cognitive distortions that might be coming up, right? So you have this low motivation and you tell yourself, right? You might jump to conclusions and say, I'll never feel happy again. There's no point in even trying. There's no point of socializing. And so what happens is it's almost a self-fulfilling prophecy, not to say that you are causing your depression, but when we're depressed, depression tells us to withdraw and not do the things that make us happy because we're convinced it won't. And so when we withdraw, we now have less opportunities to feel a sense of joy, to feel a sense of connection. And so the treatment for depression is something called behavioral activation. And we're going to talk about what that is. So with behavioral activation, we want to act from the outside in instead of the inside out. So what does that mean? Similar to what we talked about before, we want to engage in goal-dependent behavior instead of mood-dependent behavior. We know we can't think our way into feeling happy, right? We can challenge our thoughts. That's an important part of dealing with depression, is challenging our thoughts. But if all we do is challenge our thoughts, but we're staying in bed all day and not doing things that make us feel good, it's not going to help that much. So with behavioral activation, what we do is we want to intentionally schedule activities into our week that, again, give us both a sense of joy, but also a sense of accomplishment. And when we talk about scheduling things in, it's so important to think through, okay, I know that when I think about rock climbing, I went rock climbing with my sister yesterday, right? I know that when I go rock climbing, I feel really good. It improves my mood. So we don't want to say, oh, I'm going to go rock climbing this week. We want to think through, what day am I going to go rock climbing? At what time? When am I going to be most likely to follow through? Can I actually schedule this into my Google Calendar? Because all of those things are going to set us up for success. We also want to start small. You want to start with something that feels doable and challenging, but not too challenging to the point where you don't end up following through. An accountability partner can be really helpful. So if you're struggling with depression, texting someone and saying, like, making plans, that way it's harder to back out when you have someone that you're planning on doing an activity with. Mindfulness is really important. If you are spending time with a friend or going for a walk outside or going to the beach, but you spend the entire time thinking about your cancer diagnosis, well, it doesn't matter that you're doing an activity that tends to be pleasurable, because if the entire time you're ruminating in your head, you're not going to get the benefits, right? And so you can work with a therapist on how do we practice mindfulness. And then you also want to rate how you feel before the activity, during, and after. If you don't rate your emotions or your mood before, during, and after, and let's say you see friends and later that night you're reflecting on it, you might fall into that black and white thinking and think, oh, I don't feel that much better. So like, there's no point in seeing friends. It doesn't really do anything for me. But if in the moment you're actually rating through an objective measure on a scale from 1 to 10, where your mood is before, during, and after, right? Then you have that objective measure and you can see, like, oh, okay, like my mood actually did go up from a 2 out of 10 to, let's say, a 4 out of 10. I'm going to skip over this slide just for the sake of time. But again, it sounds like, Danae, you said we can send out these slides. So the last type of therapy I want to talk about is something called ACT, acceptance, and commitment therapy. So this type of therapy basically tells us that painful emotions and thoughts are not the problem. That's not what causes us distress, but it's our attempts to avoid and control these painful emotions and thoughts that causes us problems. So it says control is the problem, not the solution. So to explain this a little bit further, if you hate feeling your emotions, right? You hate feeling anxious, you hate feeling sad, which is understandable. You might turn to alcohol to numb out. So it's your attempt to suppress that emotion that's causing you the distress. right? Or maybe you shove yourself into work to avoid dealing with things in your personal life, or you judge yourself for having these emotions and thoughts and try and push them away, right? So sometimes we can fall into this belief that we need to get rid of these thoughts and emotions, but that belief might be what's making us feel miserable. And there is no way to control our thoughts and emotions. We can figure out ways to respond to the thought or emotion in an effective way, but we can't control the fact that an intrusive thought or upsetting emotion might come up. So with ACT, we're not trying to control the thought or emotion, but we're trying to let go of the rope. What I mean by that is sometimes we're in a tug of war where, let's say you feel anxious and you're trying not to feel anxious because you're like, I hate this, I don't want to feel this way, but your anxiety is pulling you in. And instead of trying to push back, we can just drop the rope and start to learn, how can I coexist with these emotions or thoughts? And we're going to talk in a minute or two how to actually do that, because it's certainly not easy. A big part of ACT is changing our relationship to our thoughts and feelings. So helping our brains realize these things are not dangerous. Helping ourselves realize, how can I coexist with these things? How can I accept these things? Actually, I'll save an example for a couple minutes from now. But basically, right, in ACT, we want to get to a place where no matter what emotion or thought comes up, no matter how uncomfortable it is, we stop pushing it away. It doesn't mean it isn't uncomfortable. It doesn't mean we have to like it. But we want to start recognizing an emotion is just an emotion. It's just like a physiological sensation that's happening in our body, right? And a thought is just a thought. And ACT is all about figuring out, how can I have these painful thoughts and emotions and still do things that make my life meaningful instead of giving into that thought or emotion. And 3 of the cornerstones of ACT, as you see in this last bullet, are mindfulness, acceptance, and values. So with mindfulness, you're not necessarily talking about meditation, although that works for some people. But mindfulness is all about just being present in the moment instead of living your life worrying about the future or being upset about the past. Acceptance, especially when we think about cancer, right? It doesn't mean that we're happy about our situation, right? But it's accepting that what has happened and that I can't control whatever's happened up until this point in your life, in my life. And then values, right? We want to live our life based on our values. Oftentimes, what gets in the way of acting on those values are these thoughts and these emotions, right? These fears, right? Maybe you want to get a new job, but you're so scared, right? You have these anxious thoughts of, oh my God, no, I know if I leave my job, I'm not going to be happy, right? And that is just a thought. And so sometimes we want to notice that our thoughts aren't always true. So again, here are some considerations. I'm going to go past this slide for the sake of time. But one thing I do want to note is that ACT, based on the research, has been found to be really helpful for chronic health conditions and diagnoses like cancer. And this over here is called the Hexaflex. These show the 6 different parts of ACT therapy. But for the sake of time, we're only going to focus on the bottom left that's titled diffusion. Observe your thoughts without being ruled by them. So we're going to end off by just talking about this last skill that we can use. And this is one that I use in my personal life. So first, we want to start by defining what cognitive fusion is. So here, the skill we're going to use is cognitive diffusion. But cognitive fusion is when we buy into a thought. We give a thought our full attention. So an example of this might be, you have the thought, everyone hates me. And then you go down that thought spiral. You create a narrative around it of, I know everyone hates me. And then you start thinking about every friend that you've lost, or every time someone said something negative about you, every time someone's abandoned you, etc. Now, diffusion is what we want to focus on here. So I'm just going to read what's here. Diffusion is when we create distance or space between us and our thoughts so that they have less power over us. Instead of viewing our thoughts as facts, we recognize thoughts for what they are. They're a string of letters, string of words that our brain has come up with. We don't need to become attached to our thoughts, but we also know that we can get rid of them, right? So with diffusion, we're acknowledging the thoughts there, but we're responding to it in a different way. So instead of becoming fused and attached to the unhelpful thoughts, we can notice the thought is there without judging it and try and separate ourselves so that we can focus on more of the helpful thoughts. So we almost learn how to coexist with this thought. And so with cognitive diffusion, unlike cognitive restructuring, where we were trying to see how true or accurate is this thought, with cognitive diffusion, we're asking ourselves, is this thought helpful or is it unhelpful? So we don't even care if the thought's true or not. We care, is this thought helping me? Is it helping me reach my goals? So if I have a thought of my cancer might spread, that thought might actually be helpful because maybe it prompts me to do a lot of research and know my options. For me, I'm very research based. I like knowing what's out there. I like knowing the facts. So it might actually be helpful. But if the thought I have is my cancer is going to spread, that thought probably isn't helpful, right? It's not helping you. It's probably just going to make you feel like a ball of anxiety. So we're going to use an example here. So let's say the thought you have is nothing is ever going to get better. Let's talk about what that would look like if you're fused with the thoughts. So if you're fused with that thought, you might go down a thought spiral of, I'm going to feel this way forever. There's no point in trying. Nothing's ever going to make me feel any better. And that might actually impact your behaviors, right? Maybe you stop responding to texts and phone calls from others. You stay in bed all day. Now, if we're practicing diffusion, and we'll talk in a minute about ways to do that, right? So the initial thought is nothing's ever going to get better. But if we practice diffusion, one way to do that is to externalize the thought. So one strategy is to say, I'm noticing I'm having the thought that, or my brain is telling me this thought again, that, right? So I notice I'm having the thought again that nothing good is ever going to happen, right? Or it's never going to get better. And so it creates this degree of separation where we start to notice, okay, this is just a thought coming up. And instead of withdrawing from everyone and everything, behaviorally, maybe we continue to maintain our friendships and do the things that make us feel good. Another way to think about diffusion is it's almost like if you've ever been in a room with a clock and all of a sudden you start to notice the second hand moving, you hear it, but for so long before that you hadn't heard it. Diffusion's similar, right? So with diffusion, we're going to distance ourselves enough so that that second hand starts to just fall into the background. It feeds into the background. It's not to say that thought might not come up again. It's not to say that thought might not be uncomfortable. It might be. But it sort of helps you create that separation so you can then focus on what's important to you and what's helpful. Again, I'm going to send out these slides, but here is a list of other strategies we can use to create that distance. The last thing I'll say, I always like to give this personal anecdote about practically what diffusion looks like. So a couple of years back, I was traveling with my family out of the country. It was like the first vacation I'd been on in a decade. And I found out that two of my family members had COVID. We were traveling together and they texted the rest of us that they had COVID. And I became incredibly anxious. And I remember I was in a museum with my brother. And at that point, we tested negative for COVID. So we knew we were okay at that point. But right, things could change. And so I was just feeling really, really worried. And I was having all these thoughts of like, oh my gosh, like, how am I going to enjoy the rest of my vacation, not knowing if I'm going to get COVID? And if I do get COVID, I won't be able to leave the hotel and all this money is going to go down the drain. And I started to notice, okay, these thoughts are not helping me, regardless of whether I get COVID or not. Thinking about this is not changing the outcome. So I tried to practice diffusion, right? And I'm like, okay, I've noticed my brain's giving me that thought again that I might get sick, right? Or that I will get sick. But when I was doing that, I noticed that I still had such a pit of anxiety in my stomach. Then I started to think, oh my God, how am I even going to enjoy this trip with all of these anxious thoughts? Like, I can't enjoy myself if I'm feeling so anxious. And then I was like, wait a second, hold up. Like, I can coexist with this emotion and these thoughts. I can still have an enjoyable time, even with feeling physically not great because of this anxiety. I can still enjoy myself, even though there's this chatter in my head. And so by virtue of just sort of dropping the rope and letting that anxiety be there, it created distance and at times actually helped those thoughts go away. They did reappear, and that's okay. The goal is not to get them to go away, although oftentimes that happens, but it's how can I coexist? So personal anecdote I wanted to share because it's not an easy strategy to use and it can be incredibly helpful. I'm going to end on this slide because I know we're just about out of time. But one thing I do want to note is a lot of therapists out there will advertise online that they use a lot of different therapy modalities, whether it's CBT, ACT, psychodynamic therapy, but in actuality, they might not. So there's certain, I could go on for an hour about this, but there's certain questions you want to ask and things you want to look out for when you're looking through therapists online to choose from. Just because someone says they do CBT doesn't necessarily mean that they do. Another thing I'll say is the research tells us that the best and biggest predictor of positive outcomes in therapy is the therapeutic relationship. So if you go to a therapist and they're just not clicking, that's okay. That happens. Don't feel like you need to stick it out. Find a therapist that you feel like you click with. Also, if finances are a concern, which especially for a lot of us it is, a lot of universities will have clinics that are run by clinicians who are in training in graduate school for therapy that's very cheap. And they're being supervised by psychologists. So they're not just sort of winging it. There are psychologists there who are supervising. Group therapy can also be really helpful, especially I think for medical issues and cancer. It can help you feel connected, less alone. And it can be helpful to look for therapists who actually specialize in oncology, or at least like chronic health issues or medical issues. And I think I will stop there to see if there are any questions.
Like Allie said, we will make sure that we upload these slides. I have a question coming in here from Vinny. This says, I work in the gym industry and have a client who can't do a box jump and will ruminate in their thoughts, just thinking they're going to fall and get into the mindset that they just can't do it and then they won't try. This sounds really familiar because this is what my 9-year-old does. So like, it's fun. What tactics could I implement to help her feel better going into it? And I think that it's important to note that this is a good question because it can be applicable to anything, right? We can get it in our heads that we're very afraid of something and we can focus on that thought. And if we can't break away from that thought pattern, that's when, it becomes restrictive. Anyway, so what are your thoughts, Allie?
Yeah, so I think there's like a few different ways to go about this, right? Like one is like the cognitive restructuring route. So if they've been able to do box jumps in the past, they can sort of challenge that thought with evidence that like they've been able to do it and they haven't fallen. But right, if we're thinking, sometimes where cognitive restructuring gets tricky is we can't predict the future. So there is a chance they could fall. And so in that case, cognitive diffusion can be helpful, maybe distancing themselves from that thought. Also exposure therapy, right? So whether it's box jumps or going to a medical appointment or flying on planes or whatever it is, when there's a fear, we can do something like exposure therapy, where you very gradually help someone do the thing they're scared of. So for example, let's say you have someone who's scared of needles, they're scared of getting their blood taken. The first step of exposure therapy might be them looking at a picture of a needle. Next step might be once they've sort of mastered that and the anxiety isn't as high and doesn't last for as long, maybe they then watch a video that has a needle. Then they watch a video of someone getting blood work. Maybe then they hold a needle in their hand, right? They can slowly expose themselves to that. So in a situation like this, right, maybe they start with jumping onto like a 1-inch box and slowly go from there. And something, my sister's also a psychologist and she and I always talk about this. A lot of it also comes down to like values and goals. So how important is this goal of yours? If this thing is important to you, you want to be able to get your blood drawn at a doctor, right? Then you want to do exposure therapy. But let's say it's actually not important to someone, right? Regardless of if I think that person should get blood work done, right? Or regardless if I think that person should be able to fly on a plane, if it's not important to them, then it's sort of up to them to figure out, okay, how worth it is it for me to work on this thing?
Well, I love what you talked about with exposure therapy because, and I have maybe a different way of thinking of this, but I've read a book called Fear is My Homeboy. And one of the things that she talks about is doing fear experiments. And really all fear experiments are is exposure therapy. It's exposing yourself to fear on purpose so that you can help your brain, like kind of prove to your brain by experiencing something new and something that maybe previously felt scary that you can do it. So like, for example, I have one eye, I have a prosthetic eye, and it became like kind of a little bit of a thing in my head that I was afraid of performing, that I was afraid that being on video, being on camera, and I'm still super self-conscious about it. Like it's in the back of my mind. I'm constantly aware of it, like all the time, but I've done enough awareness around the thought. But I've also done some kind of exposure therapy to myself or fear experiments where I've put myself in a situation where nothing bad is going to happen to me, but I'm going to put myself out there in a different way. And like I did a solo audition for like a Disney princess like performance thing where I sang a song and I didn't tell them that I had one eye. I didn't tell them at all. Like I just went into it and I performed and I pretended almost like that everything was normal or, that nothing had changed and walked out of that with zero comments about my eye, zero comments about, anything that I was afraid of. And so it just helped kind of alleviate some of those fears that other people were judging me or that they were noticing something because I was able to do that fear experiment for myself. So anyway, I love fear experiments, especially when they can be for like fun things, so to speak, or trying things that have less stakes maybe than for example, like your doctor's appointments or your scans or any of those things. Like just trying to expose yourself to the feeling of fear and the process of overcoming it in different scenarios that are less scary than cancer.
I love that. And I think, like I was talking about before, right? It's like you can only talk yourself so much out of something. And that's why I often tell like patients that oftentimes like using some sort of behavioral technique, whether it's exposure or what we might call like a behavioral experiment, which it sounds like similar to what you're talking about, Danae, like trying this out and seeing what happens, right? Does my hypothesis that this bad thing is going to come true, or does it not come true? Like that can be so much more powerful, because then you actually have the concrete evidence to help your brain shift that, like whatever belief it's holding on to.
Yeah, no, exactly. Like it's so interesting to me the way that the brain works, and
Mm-hmm.
the ways that we're able to kind of work with things. So cognitive, like if we're kind of going back, I guess the main question that I have is cognitive behavioral therapy, or CBT. I've always kind of thought of this as like the structured reframe. But listening to you talk about ACT or ACT therapy, like I kind of feel like maybe what I'm more familiar with is actually ACT than CBT, like just because of the process of how you kind of go through the thought diffusion. And I'm like, oh, you know what? I think that might actually be closer to what I actively engage in when I'm working with my therapist, and just what I have kind of naturally veered toward in all of the tools and the things that I've, developed all of these. And it also might just be kind of part of the way that my brain works to begin with, is that that's just how I think about the world and how I process things. And so falling into that kind of a support with that kind of therapy has been a lot easier than, for example, doing something different. Like, I'm not saying EMDR is not helpful. I've done EMDR, but it's also not something I'm quite as naturally comfortable with, like
Mm-hmm.
as like ACT therapy, where I would be talking through something. I'm definitely a verbal processor. I don't know about you guys listening, but like I am 100% a very verbal processor. But I like what you pointed out about how sometimes there is a point that you can only do so much, right? You can only talk yourself through it so many times before you have to try something different. Are there any kind of techniques that you use with your patients? Something very simple you could do.
Yeah, sure. I would say this is more so used when emotions are like incredibly high. So anywhere from like an 8 out of 10 to a 10 out of 10. And this actually stems from DBT, dialectical behavioral therapy, which also stems from CBT, many 3-letter acronyms here. And so this skill is called TIP, and it's also an acronym itself. It's something we use when we notice a lot of intense, heightened physiological things happening in our body, right? So whether you're super angry and you're noticing like that anger in your body, or very anxious, we can use this skill. And so TIP stands for, the T is tip the temperature, I is intense exercise. So that could be like doing push-ups or box jumps for 2 minutes. P is for paced breathing. With paced breathing, you always want to exhale for longer than you're inhaling to calm your nervous system down. But the T for tip is tipping the temperature. And I'll talk about that briefly for a minute. So some context here that's important. So there's something out there called the diver's reflex. So if you dive underwater, your brain senses the cold and it triggers the parasympathetic nervous system. So the parasympathetic nervous system is the opposite of the autonomic nervous system. So we can think of like fight or flight, right? When adrenaline's pumping, anxiety is really high, and there's a threat. Parasympathetic nervous system helps calm down that fight or flight system. And the reason it's triggered when you go underwater is because your brain senses, okay, I'm underwater. I need to conserve as much energy as possible and as much of my breath. So it triggers the parasympathetic nervous system, slows down your heart rate, breathing rate, all of that. And so for this tip skill, if we tip the temperature, what you can do is you can put an ice pack on this part of your face for 30 seconds on, 10 seconds off. You want to do that for a couple of minutes. Or you can fill up the sink with cold water and put up to your hairline, your face in, again, for 20 to 30 seconds, holding your breath. It triggers and tricks your brain into thinking you're underwater. And what it will actually do is calm down your heart rate. And then, of course, you're like so focused on like that cold sensation. It might also help just slow down that like rumination and all of those thoughts that are going through. You can even look up videos on YouTube. Like the second you start submerging your face in cold water, you can see someone's heart rate very quickly decreasing. So that's like a quick, like easy and dirty way to just like calm yourself down. It's not going to make you feel fully better, but it's going to take the edge off just enough so that maybe you're in a more grounded place to then challenge your thoughts or do exposure therapy or something like that.
Yeah, no, exactly. And I love that you brought up the temperature, and remind us again, it was the temperature is the T, I is
Intense exercise. And that could be for like
intense
2-3
exercise.
minutes. Doesn't have to be for super long, but you do want it to be intense. You don't want it to be like, oh, I'm just walking outside. And I'll also, sorry, just to say for the tipping the temperature, splashing cold water in your face, some people find that helpful. If you do, great. That is different than this exercise. So here you want to be submerged in that cold. And then the P is for paced breathing. Slow inhale through your nose, exhale through your mouth, about like 3 to 4 seconds inhale, 6 seconds exhale. really making sure the exhale is longer than the inhale, or else it won't calm down that like physiology that's happening.
Okay, not me just like typing this into my little therapy technique ideas because
I
I'm like,
love that.
oh, I love this. I just saved that in my little notes section of my phone that has like therapy ideas or like, techniques for it's just basically my notes from therapy of anything that I need to write down to either practice or to lean on. I will tell you, like just from personal experience, and I'm sure Allie, you can attest to this as well, trying the tip exercise or trying meditation or even just trying these reframes and like learning to think in this kind of a way, it's a process, right? It's not going to happen overnight. It's not going to happen instantaneously. And I think one of the worst things that we can do as human beings is dwell on like the guilt or the shame that somehow we didn't do it well enough
Hmm.
because it is helping you, even if you don't really feel like you get the results out of it right away that you wanted. But also, like, it's something that when you're in the minute of, something a lot more distressing, like maybe you just got really bad scan results and you're in the emotional kind of freak out of it. It's okay. Like if you can't immediately think of all of the techniques that you've learned or that you've practiced, even if you have 15 years of practice, it's just so important to normalize that you may not immediately implement one of these techniques from your toolbox, so to speak. It might take a minute, it might take a couple days, and that's okay. Just know that they're there. Remind yourself of them and using them when you can, or having support network people in place who can help remind you to do that is so important because like I can't tell you how many times my therapist will be like, oh, did you do your 5-point check-in? And I'm like, I know what to do, I know how to do it, did I do it? It's like the dentist asking me if I flossed. Like, I mean, sure, a little bit, probably not as much as you'd like me to, but it gets better with time, right? And the more that you
Hmm.
try it, like the easier it gets. Have you ever heard of this one? It's the five senses where you do a few deep breaths. I think it's like 3 to 5 deep breaths. And then you look for 5 things you can see, 4 things you can touch, and you physically touch them if you can. 3 things you can hear, and you can either think of a sound, a song, or whatever, or just listen for what's in your surroundings. 2 things you can smell, and if possible, smell them. So like I actually have like an essential oil that is in a little container that I'll carry it around, and it's my 5-point check-in box, and it's tiny. And if I will just grab it off the counter and use it. And then one thing that you can taste, like a piece of chocolate is mine, and I'll like actually eat a piece of chocolate, or you can think of like a favorite flavor and then close it with another 3 to 5 deep breaths. And guys, this takes, I mean, Allie, how long do you think that takes? Maybe 3 minutes? Not even
Yeah,
that.
it's that. Yeah.
Like if that, the effect of how quickly you can go from a feeling of panic to just being more calm and grounded and centered is, I mean, it's really instantaneous and it's not complicated. And I mean, if you know your 5 senses, you could do something like that. But I love your acronym of TIP because it's just 3 things, right? Is the TIP a good idea for those in our community who maybe are listening and maybe they're just physically unable to do intense exercise? Like, would you say that TIP is still accessible to them? Is there something they can do like that is intense enough to help in that moment?
Yeah, I think like if you're in a body that, exercise is just like not practical for you, right? Obviously, like going for a walk, if you're able to do that, still great. Doesn't necessarily fall into like the eye and tip in that like traditional sense. Obviously, at the end of the day, do whatever works for you, right? But if the exercise doesn't work, then doing the temperature or the paced breathing. The paced breathing is
Mhm.
nice because you could really do that anywhere. There's like one last part of tip. Actually, it's 2 piece called progressive muscle relaxation. I didn't mention it because we
Oh,
probably don't have
yeah.
the time for it. That's another great one if anybody wants to look that up on YouTube.
Yeah, no, progressive muscle work relaxation, I think, is one that my 11-year-old's therapist just worked with him on learning that. And I think that we've actually even done that a little bit in some live sessions that I believe where we've had a therapist or also a meditation expert like kind of walk us through like that kind of what does that feel like. So yeah, definitely look up, you said progressive muscle relaxation.
Yep, you got
Yeah.
it.
Okay, so progressive muscle relaxation. Well, you guys, we are at the top of the hour. Allie, this has been fantastic. Those of you guys who gave us some feedback, gave us some questions, thank you so much. If you guys do have any other questions, please don't hesitate to reach out to us at contact@acureinsight. Like I said before in one of the previous sessions, if you need the extra support from other patients, we do have a Zoom support group that you are more than welcome to join into, and we would love to have you come and just participate in that. That's on Tuesday nights and it's at 7 p.m. Eastern time and it's run by patients. So just know that that is accessible to you. But for now, I want to just say again, thank you to Allie, and we'll go ahead and send her off so I can finish off the last bit of announcements for the rest of the day.
Thanks so much.
Bye.